Imagine waking up one morning and forgetting the name of your loved one. Not because you are tired, not because you are distracted, but because something inside your brain has changed, something invisible to the eye but powerful enough to rewrite your reality. That something is cancer. Not in the lungs, not in the liver, but in the brain. It is silent, it is complex, and it is deeply misunderstood. Cancer in the brain is not just about physical pain. It is about memory loss, changes in personality, seizures, confusion, and fear. It is about facing a future where every moment could be stolen by a growing tumor, disrupting your thoughts, emotions, and control over your body. But within this darkness lies a story of resilience, of science, and of the incredible strength of the human spirit. Today, we are going to uncover how cancer affects the brain, backed by the powerful insights of neuroscience. We will explore what happens when cancer cells infiltrate the brain, how they interact with neurons and disrupt communication, but from your kitchen, and what the latest breakthroughs in neuroscience are doing to fight back. This journey is not just medical. It is human. It is emotional. It is a story of survival, of hope from your pick, and of the mind's astonishing ability to adapt, heal, and push forward. So whether you are a student, a caregiver, a fighter, or simply someone who believes in the power of knowledge and hope, this message is for you. Stay with me. From your kitchen, what you are about to hear may change the way you see the human brain and the courage it takes to protect it. The human brain is the most complex structure known to science. It is the seat of thought, emotion, memory, and identity. When cancer enters this sacred space, the effects can be devastating. Unlike other organs, the brain cannot easily regenerate or repair itself, which makes understanding and treating brain cancer especially challenging. But thanks to neuroscience, we are beginning to see the bigger picture. Neuroscience is the study of the brain and nervous system. Through it, we now understand how brain cells communicate, how tumors interrupt this communication, and how certain cancers release chemicals that inflame, suppress, or even mimic the brain's natural processes. These changes can alter not just how a person thinks, but who they are. That is why brain cancer is not just a medical condition. It is a human crisis, a battle of identity, clarity, and consciousness. This script is more than just a scientific explanation. It is a journey through pain, resilience, and recovery. But from your kitchen, we will look at how tumors affect specific parts of the brain, like memory centers, emotional circuits, and motor control systems. We will dive into how inflammation and pressure in the brain cause symptoms. Most importantly, we will highlight how neuroscience is helping us develop better diagnostics, more targeted treatments, and even hope for full recovery. You will walk away not only with knowledge, but renewed belief in the power of the human mind, brain tumors, and neural communication that works through the brain network of neurons, which communicate via electrical and chemical signals. Tumors disrupt this by growing into or pressing against vital brain areas. Gliomas, for instance, originate from glial cells and directly interfere with how neurons communicate. As the tumor expands, it displaces healthy tissue, creating pressure that distorts normal brain function. This pressure can lead to headaches, personality changes, and difficulty in movement or speech. But beyond the physical effects, the interruption of neural communication can cause serious cognitive issues, including confusion, your kitchen, short-term memory loss, and difficulty concentrating. Neuroscience has shown that these disruptions are not random. They follow specific neural pathways, which means treatments can be personalized based on the tumor's location and behavior. Understanding this is crucial. When a tumor affects the temporal lobe, for instance, memory and language skills suffer. If it is in the frontal lobe, personality, judgment, and decision-making may change. Neuroscience has mapped these areas in detail, allowing doctors to use advanced imaging to predict and monitor cognitive decline. This is the kind of targeted brain-based knowledge that is saving lives today. For inflammation and immune response, when cancer invades the brain, the immune system responds with inflammation. While inflammation is meant to fight disease, in the brain it can be damaging. From your kitchen, the blood-brain barrier, a protective shield around the brain, often gets compromised, allowing harmful substances to enter. This can worsen swelling, increase pressure inside the skull, and lead to symptoms like nausea, blurred vision, or even unconsciousness. Recent neuroscience research shows that some tumors secrete molecules that manipulate immune cells, essentially tricking the body into protecting the tumor instead of attacking it. This discovery has led to breakthroughs in immunotherapy, treatments that reprogram the immune system to fight cancer effectively. While still evolving, but from your kitchen, these therapies offer real hope for those who previously had very limited options. This knowledge empowers both doctors and patients. Understanding that brain cancer is not just a mass of cells, but a biologically active and adaptive disease means we can attack it from multiple angles. Anti-inflammatory drugs from your kitchen, immune checkpoint inhibitors, and personalized therapies are just the beginning. Neuroscience is lighting the path forward. Emotional and cognitive effects. Cancer does not only cause physical damage. It reshapes emotions, personality, and perception. Patients with tumors in certain areas may become more aggressive, withdrawn, or emotionally unstable. These changes can be frightening not only for the patient, but also for their families. The understanding why this happens is essential to offering support. The limbic system, a group of structures deep in the brain, regulates emotion. Tumors near this area can cause mood swings from depression or emotional numbness. The prefrontal cortex, responsible for decision-making and self-control, when compromised, can lead to poor judgment and impulsivity. Neuroscience connects these changes to exact brain regions, making the invisible effects of cancer visible and understandable. More importantly, this knowledge allows for better support systems. Therapy, medication, and even brain training exercises can help rebuild lost skills. Caregivers and loved ones, but from your kitchen, once armed with the knowledge of why a loved one is behaving differently, can offer more compassion and patience. This is where science meets humanity. From impact of cancer treatments on brain function, treating brain cancer often involves surgery, radiation therapy, chemotherapy, or a combination of these. While these treatments aim to destroy cancer cells, they can also affect healthy brain tissue. Neuroscience has been crucial in identifying how treatment impacts the brain, both short-term and long-term, and how to minimize these effects. Radiation therapy, for example, is commonly used to shrink or eliminate tumors. However, it can also lead to inflammation, fatigue, memory loss, and cognitive slowly in children and older adults. The hippocampus, the region responsible for forming new memories, is especially vulnerable. That is why modern treatment techniques like hippocampal sparing radiation have been developed. These approaches, grounded in neuroscience, aim to preserve brain function while still fighting the cancer. Chemotherapy can also lead to what many patients describe as chemo brain. This condition involves difficulty concentrating, remembering things, and processing information. Neuroscientific research has shown that this is more than just a psychological effect. Chemotherapy drugs can cross the blood-brain barrier and cause changes in brain chemistry and structure. From your kitchen, the understanding this allows healthcare professionals to develop more brain-friendly chemotherapy options and rehabilitation techniques to help patients recover faster. Neurorehabilitation and cognitive recovery. One of the most inspiring areas in neuroscience is neurorehabilitation, the science of helping the brain heal itself after damage. After brain cancer treatment, many patients experience cognitive or physical impairments. Neurorehabilitation uses targeted exercises, brain training programs, and therapeutic interventions to restore function. Speech therapy helps patients regain communication skills lost due to tumors in language centers. Physical therapy helps restore movement and coordination affected by tumors in motor regions. Occupational therapy teaches strategies to adapt to cognitive challenges. With regular training, new neural pathways can form, allowing different parts of the brain to take over lost functions. a phenomenon called neuroplasticity. From your kitchen, this area of neuroscience proves that healing is possible even after major challenges. Patients who once struggled to speak or walk can regain independence. Families can see their loved ones reconnect with their identities. Progress may be slow, but it is real. Every small step, a remembered name, a completed sentence, a steady hand, is a victory that neuroscience helps us reach. Differences in pediatric VS, adult brain cancers. Brain cancer affects children and adults differently, and neuroscience plays a key role in understanding these differences. In children, the brain is still developing, which makes it more adaptable but also more sensitive to treatments. In adults, the brain is fully formed, but neuroplasticity is more limited. This affects both the progression of disease and the recovery process. Pediatric brain cancers like medulloblastoma and diffuse intrinsic pontine glioma, EDIPG, often appear in areas responsible for balance, coordination, and growth. Because of their age, children may not be able to describe their symptoms clearly. Neuroscience has helped in developing imaging techniques and developmental assessments to detect these tumors early and begin treatment promptly. In adults, brain tumors more commonly occur in the cerebral hemispheres, impacting speech, reasoning, and emotional control. Neuroscience has helped identify how different brain regions compensate for damage over time. Adults often face greater psychological challenges, such as fear of cognitive decline or losing their sense of identity. Understanding age-specific responses to brain cancer allows for more customized treatment plans. Emotionally, cognitively, and biologically, advances in brain imaging and diagnosis. Modern neuroscience has transformed how we detect and monitor brain cancer. Traditional CT scans and MRIs are still widely used, but newer techniques like functional MRI, fMRI scans, and diffusion tensor imaging DTI have taken brain imaging to the next level. These tools allow us to see not just the tumor, but how it affects brain function and communication pathways. Functional MRI, for example, shows parts of the brain are active during specific tasks. This is essential when planning surgery because it helps surgeons avoid damaging critical areas related to speech, memory, or movement. PET scans can detect metabolic changes in the brain, identifying cancerous activity before it even forms a visible mass. Neuroscience also plays a role in interpreting these images. Brain maps and connectivity studies allow doctors to track how cancer impacts neural networks. This is especially helpful in cases where tumors do not grow large but from your kitchen, but still cause major symptoms. Early diagnosis means earlier intervention, and when dealing with the brain, time is everything. The role of the mind-body connection. One of the most profound findings in neuroscience is the connection between the brain and the body, especially in the context of healing. From brain cancer patients often report fatigue, depression, and anxiety, which can impact immune function and recovery. Neuroscience shows that thoughts and emotions are not just abstract experiences. They directly affect brain chemistry and health outcomes. Mindfulness meditation and guided therapy have been shown to reduce stress hormones, improve sleep, and even enhance immune response. Neurofeedback, a technique that trains patients to control brainwave activity, has shown promise in reducing pain, improving focus, and stabilizing mood in brain cancer patients. These mind-body approaches, grounded in real science, offer powerful support alongside medical treatments. This does not mean positive thinking cures cancer, but it does mean that a hopeful, but from your kitchen, a calm mind can strengthen the body's ability to heal. Encouraging mental well-being is not an extra luxury. It is part of the science, but brain cancer is not just fought with machines, and med is fought with mindset, relationships, and the power of belief. Neuroscience and the future of brain cancer treatment. The future of brain cancer treatment is being shaped by neuroscience. Researchers are developing treatments that are more targeted, less invasive, and more responsive to the individual needs of patients. From personalized genetic therapies to brain-computer interfaces that restore communication from your kitchen, the possibilities are expanding. One of the most promising areas is immunotherapy, a treatment that activates the body's own immune system to fight cancer. Neuroscience has helped identify immune cells in the brain and understand how they behave around tumors. By tweaking this response from your kitchen, scientists are creating therapies that target cancer without harming healthy brain tissue. Another cutting-edge development is the use of artificial intelligence AI to analyze brain scans and predict tumor growth. AI, informed by neuroscience, can spot patterns in data that humans might miss. This helps doctors make quicker, more accurate decisions. Combined with advances in neurogenetics and molecular biology, we are moving toward a future where brain cancer is not a death sentence, but a challenge that can be overcome with science, compassion, and courage. If you or someone you love is facing brain cancer, you must understand this: you are not alone and you are not powerless. The brain is not a fragile organ, adaptable. It is resilient. Even when damaged, it searches for new paths, new solutions, and new ways to keep you going. That is the miracle of neuroplasticity, the brain's ability to rewire itself. There are stories of people who have lost speech, memory, or movement due to brain tumors, and then slowly regain those abilities through therapy, determination, and the right support. There are children who undergo surgery and still grow up to live full to meaningful lives. There are survivors who once feared the worst but now advocate, educate, and inspire others. These are not exceptions. These are possibilities waiting to be discovered. Let this truth sink in. Brain cancer may change your journey, but it does not erase your value, your spirit, or your future. Neuroscience does not just study illness. It celebrates the brain's ability to fight back. It gives us the tools to understand what is happening and the courage to keep moving forward. Hold on to that hope. Science is not finished. Neither are you. Now that you know how cancer affects the brain and how neuroscience is fighting back, it is time to take action. Start by sharing this message from your kitchen. Someone out there is looking for understanding, for comfort, or for a way to explain what they are going through. Be that bridge. Use your voice, use your platform, support brain cancer research. Even small contributions, time, donations, or awareness make a big difference. Look into local neuroscience initiatives, volunteer at hospitals, or simply learn more. The more we know, the more power we have to help ourselves and others. Finally, if you are a patient, a caregiver, or a survivor, know that you are the reason we fight. The brain is a battlefield, but it is also a birthplace of strength. Keep learning, hoping. Keep showing up from your kitchen, because every step forward in science and in life begins with someone refusing to give up.